Hello people, in this video we will be learning about acute pancreatitis. Pancreatitis is inflammation of pancreas. As you would have already read about pancreas, so here I am giving you a gist of it. So pancreas is a gland which has both endocrine as well as exocrine parts, and embryologically it's derived from foregut endoderm. So talking about this anatomy, it lies obliquely in concavity of duodenum. अगर length की बात करें, that's of 15 centimeter and weight is 100 gram. Okay. It has three topographic zones: head, body, and tail. So head, it lies in the concavity of duodenum, and it has a projecting uncinate process. And body is the main part of a gland, and tail, it's the tapering part which is towards the hilum of spleen. Okay, now here our topic is acute pancreatitis. So acute pancreatitis is an acute inflammation of pancreas. What acute inflammation is, it's the short-term process. Okay. So this acute pancreatitis, it may be presenting clinically with acute abdomen. Now what acute abdomen is a severe sudden abdominal pain. Okay, and what will happen sometimes, the severe form of acute pancreatitis is associated with what? It's associated with either with the microscopic hemorrhage or with the fat necrosis in and around the pancreas. यानी पेनक्रियाज के इर्द गिर्द या तो फैट की नेक्रोसिस होगी और देयर विल बी अ माइक्रोस्कोपिक हेमरेज. दैट टाइम इज कॉल्ड एज acute hemorrhagic pancreatitis or acute pancreatic necrosis. Okay, now this condition, it occurs between the age of 40 and 70 years. Okay, it occurs in adults and it's more common in females than in males. The onset of acute pancreatitis, it's sudden. Okay, after we can say it occurring after a bout of alcohol or a heavy meal. The patient क्या present करेगा? The patient may present an abdominal pain, vomiting, or collapse. Now what's a collapse? The patient will fall down and become unconscious. Okay, so but itna zehn mein rakhna hai that time it must be differentiated, okay, from other diseases like we can say acute appendicitis, perforated peptic ulcer, acute cholecystitis, etc. Okay, now what happened characteristically, there is elevation in the serum amylase within the first 24 hours, and after 3 to 4 days the serum lipase rises and glucosuria is seen in 10% patients. Now what is it? It's the amount of glucose in a urine. Okay, now talking about the etiology of acute pancreatitis, the two leading causes which are associated with it are the alcoholism and the cholelithiasis. What's alcoholism? You know, it's an addiction to alcohol, and cholelithiasis is the formation of gallstones. Okay, less common, the causes are trauma. Trauma, as you know, it's the response to deeply distressing event. Okay, and ischemia, the reduced blood supply, and the shock. These are the less common causes, and the blood-borne infection, viral infection, and certain drugs like thiazides, sulfonamides. Hypothermia. Hypothermia is the significant drop in the body temperature. Okay, now what's hypercalcemia? It's we can say it's the increased level of calcium in the blood. And hyperparathyroidism, these are the less common causes of what? Of acute pancreatitis. Okay, now let's see the pathogenesis of acute pancreatitis. Now what happens? The pancreatic enzymes, those get liberated and activated by some destructive changes in the pancreas. Okay, now what happened? Though more than 20 enzymes are secreted by exocrine pancreas, but three main groups of enzymes which bring about the destructive change. Okay, destructive effects we can see on pancreas, those are as under. First are the proteases such as trypsin and chymotrypsin. ये क्या करते हैं? They play an important role in what? In proteolysis. Now what's proteolysis? It's the breakdown of proteins in small polypeptides. Okay, and what trypsin do? It activates the kinin system. Kinin system को activate करेगा, फिर kallikrein को convert करेगा into what? Into kallikrein. And what will happen? The clotting and complement system will get activated. Okay. Now second group is the lipase and the phospholipase. They degrade lipids and membrane phospholipids. And the third enzyme, which is the elastase, it causes destruction of elastic tissue of what? Elastic tissue of blood vessels. Okay. Now the activation and release of these enzymes is brought about by one of the following mechanisms. तीन में से एक mechanism ऐसा होगा जिससे सारी changes होंगी, destruction होगी pancreas की. That will be either due to the acini cell damage. इसमें क्या होगा? It may be caused by some etiologic factors like alcohol, okay, and viruses, drugs, ischemia and trauma. जिसकी वजह से क्या होगा? There will be a release of intracellular enzymes, or it may be due to the duct obstruction, which may be caused by cholelithiasis and chronic alcoholism and other obstructing lesions, जिसकी वजह से there will be a leakage of pancreatic enzymes from the ductus into what? Into an interstitial tissue. या तो तीसरा mechanism होगा block in exocytosis of what? Of pancreatic enzymes. Okay. जिससे क्या होगा? It may be occurring from what? From nutritional causes, जिसकी वजह से there will be the activation of intracellular enzymes by what? By pancreatic lysosomal hydrolase. Pancreatic lysosomal hydrolase, it will do what? It will activate the intracellular enzymes and will cause the destruction of pancreas. So it was the pathogenesis. Okay. Now let's see the morphologic features. Grossly अगर हम देखेंगे, in the early stages, the pancreas will be swollen and edematous. There will be edema, and day to 2 there will be the appearance of gray-white pancreatic necrosis. Necrosis हुई होगी pancreas की, और fat necrosis होगी that will resemble a chalky white. We can say that will be a chalky white fat necrosis, and there will be a blue-black hemorrhage. अगर microscopically, if we will see microscopically, there will be a necrosis of pancreatic lobes and ducts, and there will be necrosis of arteries and arterioles within the areas of hemorrhage. And third, there will be the fat necrosis, and fourth, there will be inflammatory reaction, chiefly by what? PMNs, polymorphs around the areas of necrosis and hemorrhage. ये चीजें हमें देखने को मिलेगी microscopically, and these are the things which we will see grossly in the acute pancreatitis. In what? In pancreas. Okay. Talking about the complications of acute pancreatitis. Now, a patient of acute pancreatitis who survives may develop a variety of systemic or a local, we can say, complications. Systemic की बात करें, the patient may develop chemical and bacterial peritonitis. That's the infection of the ascitic fluid, we can say. Second, the endotoxic shock. It's a life-threatening condition, as you know. An acute renal failure. Kidneys can't filter the waste. And the second, if you will see locally, the patient may develop pancreatic abscess or the pancreatic cirrhosis. Now, what cirrhosis is the circumcised collection of fluid which is rich in pancreatic enzymes and blood and the necrotic tissue. And the third complication may be the duodenal obstruction. Now, if we talk about the mortality rate in acute pancreatitis is higher. That's the 20 to 30%, and the patients come to what? Hypotensive, shock, or we can say infection. Hope you would have understood what acute pancreatitis is. Thank you for watching my video. Bye.